US style question. Endocarditis secondary to Streptococcus sanguinis. Question. A 55-year-old male with a history of mitral valve prolapse and dental procedures in the past year presents with a fever, malaise, and heart murmur. He also reports chills and night sweats for the past 2 weeks. On examination, he has a new onset murmur and splinter hemorrhages in his nails. Blood cultures are drawn, and Streptococcus sanguinis is isolated. The patient is diagnosed with infective endocarditis. Which of the following is the most likely predisposing factor for this patient's condition? A. Chronic intravenous drug use. B. Prosthetic heart valve. C. Recent dental procedure. D. Congenital heart defect. Tetralogy of Fallot. E. Recent abdominal surgery. Explanation. Correct answer. C. Recent dental procedure. Streptococcus sanguinis is a normal oral flora bacterium and is commonly associated with infective endocarditis, particularly in patients with pre-existing valvular abnormalities, such as mitral valve prolapse. The recent dental procedure likely caused transient bacteremia by allowing S. sanguinis to enter the bloodstream. This bacterium is commonly involved in endocarditis in patients with damaged heart valves, e.g. mitral valve prolapse, where it can colonize and infect the heart valves. Why are the other options incorrect? A. Chronic intravenous drug use? Incorrect. Chronic intravenous drug use is associated with Staphylococcus aureus as the most common pathogen for infective endocarditis. S. aureus often causes endocarditis in intravenous drug users, typically affecting the tricuspid valve. B. Prosthetic heart valve? Incorrect. Prosthetic heart valve infections are more commonly caused by coagulase-negative staphylococci, e.g. Staphylococcus epidermidis or Staphylococcus aureus. S. sanguinis is less common in prosthetic valve infections. D. Congenital heart defect, tetralogy of Fallot? Incorrect. While tetralogy of Fallot and other congenital heart defects can predispose to infective endocarditis, this patient has mitral valve prolapse, and S. sanguinis is more commonly linked to dental procedures in such patients rather than congenital defects. E. Recent abdominal surgery? Incorrect. Recent abdominal surgery does not typically predispose to infective endocarditis caused by S. sanguinis. Infections after abdominal surgery are more commonly caused by Enterococcus and gram-negative bacteria. Key learning points. Streptococcus sanguinis is a normal oral flora bacterium and is a common cause of infective endocarditis, particularly after dental procedures in patients with underlying valvular heart disease, e.g. mitral valve prolapse. The infection typically presents with fever, malaise, heart murmur, and splinter hemorrhages.